Call the meeting to order. Welcome, everyone. I'm Peter McKenna, chair today. I'll start with our land acknowledgement. On February 11th, we acknowledged that this sacred land on which Smith Falls is now located has been a site of human activity for over 10,000 years and is rich in Indigenous history. This land is the ancestral and unceded territory of the Algonquin Anishinaabe Nation. We're grateful to the Algonquin ancestors who cared for the land and water in order that we might meet here today. We're also grateful to the Algonquin people for their contribution in the making of the Rideau Canal, which runs through Smith Falls. We're mindful of broken covenants and the need to reconcile with all our relations. Together, may we care for this land and each other, drawing on the strength of our mutual history of nation building through peace and friendship, being mindful of generations to come. Looking at the agenda, I'm going to ask if there's any changes. Seeing none, I'll see a person to move the approval of the agenda. Joanne, seconder, please. Linda, no further discussion, all in favor? That's carried, thank you. And then we'll look at the minutes of the January 14th, 2025 meeting. Are there any errors or omissions in those minutes? People had a chance to look at them. Not seeing any. Again, I'll see a motion to approve the minutes of the January 14th, 2025 meeting. Moved by Sue. Is that your hand up there, Sue, the minutes?
Sure.
Thank you. And seconded by Linda. No further discussion, all in favor? That's carried, thank you. With that agenda approved, does anyone want to declare any monetary interest or any conflict of interest? Seeing none, we'll move right on to the priority item number 1, which is 5.1, climate change and health vulnerability assessment. And Zara Youssef is here from the Southeast Health Unit, formerly Leeds Greville Lanark District Health Unit. Welcome, Zara. I have to say, Joanne has built this up as something really exciting, and we're really looking forward to having the presentation.
Amazing being here. Good afternoon, everyone. My name is Zara, and today I will be presenting on climate change and health and vulnerability assessment. So this presentation will highlight key climate-related health risks, how they affect our communities, and what municipalities can do to mitigate and adapt to these changes. Climate change is no longer a distant environmental issue. It's a public health crisis. It affects air and water quality, increases the frequency of extreme weather events, and alters the spread of diseases. Today, we will be discussing why municipalities play a critical role in responding to climate-related health impacts and how the health unit can support these efforts. So this is the outline for today. What we'll be covering is the role of public health in addressing climate change, the impact of climate change on health, the Climate Change and Health Vulnerability and Adaptation Assessment, CCHVAA, why climate change matters to municipalities, mitigation and adaptation strategies, and how the health unit can support municipal climate action. So the role of public health in climate change. Public health plays a crucial role in addressing climate change because it affects multiple Ontario public health standards, and climate change risks impact air quality, which increases respiratory illnesses, heat and extreme weather, leading to hospitalization and deaths, vector-borne diseases such as Lyme disease, and food and water safety, which affects the risk of contamination. As a public health entity, our role is to monitor climate-related health impacts, educate communities, and provide evidence-informed recommendations for risk and reduction and adaptation. So what is climate change? Climate change refers to long-term shifts in weather patterns, including rising temperatures, altered precipitation, and more frequent extreme weather events. While natural climate variations exist, human activities such as burning fossil fuels, cutting down forests, are driving rapid and unprecedented climate changes. So this leads to higher average temperatures, more frequent and severe heat waves, storms, and wildfires, changes in air quality and water availability, and new patterns for disease transmission. So climate change and health. The impacts of climate change on health are wide ranging and serious. So extreme heat leads to dehydration, heat stroke, and cardiovascular stress. Air pollution worsens asthma, lung disease, and cardiovascular conditions. Extreme weather events cause physical injuries, disrupt healthcare services, and increase mental health stress. Vector-borne diseases such as Lyme disease and West Nile virus are spreading to new areas, and food and waterborne illnesses increase due to high temperatures promoting bacterial growth in food and water. So addressing these challenges requires urgent action from all levels of government and the health sector. So climate change and health vulnerability and adaptation assessment, which is again CCHVAA. To assess climate-related health risk, we conducted a CCHVAA for the Southeast region, covering Leeds, Granville, Lanark, Kingston, Frontenac, Lennox, and Eddington, and Hastings, Prince Edward. So this assessment helped us define the role of public health in each climate adaptation, collect and analyze data on the local climate trends and the impact on health, identify vulnerable populations, including seniors, children, and those with chronic illnesses and low-income households, and develop evidence-based recommendations for public health and the municipalities. So the findings provide municipalities with critical data to integrate climate considerations into emergency planning, infrastructure development, and public health programming. So what we did for our CCHVAA. So to conduct the climate change and health vulnerability and adaptation assessment for our region, we used a multi-method approach to gather both qualitative and quantitative data. Our goal was to identify climate-related health risk, assess the most vulnerable populations, and develop actionable recommendations to improve public health resilience. So our assessment included the following key components, which is the staff survey was the first part. We conducted a survey among public health staff to assess their understanding of climate change and health, as well as identifying gaps in knowledge and gather insights into our local climate health related concerns. We also collected local climate data, which is we analyzed historical and projected climate trends, including temperature fluctuations, extreme weather events, and seasonal variations to determine the potential health impacts on our communities. Also, we reviewed CCHVAA's reports from other regions, and we examined vulnerability assessments conducted in other municipalities and regions to compare findings, identify common risks, and apply best practices that we could be adapted into our local context. We also did an academic and public health data analysis where we reviewed scientific literature, public health surveillance data, and environmental reports to better understand the relationship between climate change and health outcomes. So this included data on hospital admissions, emergency room visits, air quality, and infectious disease trends. Key informant interviews were also done where we engaged municipal planners, emergency responders, healthcare providers, and community organizations to gather expert perspectives on climate vulnerabilities and potential adaptation strategies. So these interviews provided valuable insights into local challenges and opportunities for collaboration. We also did an identification of health hazards and vulnerable populations. So using the collected data, we identified the primary health risks posed by climate change in our region, such as extreme temperature, air pollution, vector-borne diseases, and we also pinpointed the population most at risk. So the development of recommendations for action was another piece where we, based on our findings, we formulated a set of evidence-based recommendations both for public health agencies and for municipalities. So these recommendations focus on improving emergency preparedness and climate resilient infrastructure, community education, and policy integration to mitigate risk and enhance adaptation efforts. So through this comprehensive approach, RCCHVAA provides a data-driven foundation for climate and health planning in our region, ensuring both public health officials and municipal leaders have the information needed to protect residents from climate-related threats. So focusing on now the health hazards. So through our climate change and vulnerability and adaptation assessment, we identified key climate-related health hazards that pose risk to our communities. So this research was conducted using multiple methods, including literature reviews of various academic sources, analysis of public health data, staff survey, and key informant interviews, and local climate assessments. So by integrating the diverse data sources, we ensured a comprehensive understanding of the potential health impacts of climate change. So the key climate-related health hazards identified in our region included extreme temperatures, so like heat and cold, and that was basically focusing on the increased frequency and intensity of heat waves, led to heat stroke, dehydration, and high risk of chronic illnesses like cardiovascular and respiratory diseases. Cold temperatures increase the risk of frostbite and hypothermia, particularly for individuals experiencing homelessness or living in poorly insulated housing. The second hazard we focused on was extreme weather events, so such as flooding, storms, and wildfires can cause physical injuries, displace residents, and disrupt essential services, including healthcare. They also contribute to mental health challenges due to stress, trauma, and loss of homes or livelihoods. And the third hazard was air pollution, which was emission from traffic, industry, and wildfires contribute to poor air quality, which increases respiratory diseases such as asthma, chronic obstructive pulmonary disease, COPD. And indoor air quality can also be affected, particularly for vulnerable populations like children, seniors, and those with pre-existing conditions. UV radiation was one of the health hazards we focused on, and which is basically increased exposure to ultraviolet rays due to climate change raises the risk of skin cancer, sunburns, and heat stress. And prolonged exposure without adequate protection can also weaken the immune system. And the last two we focused on were vector-borne diseases, where it's basically rising temperatures and changing precipitation patterns allow disease-carrying mosquitoes and ticks to expand their range. This then increases the prevalence of illnesses such as Lyme disease and West Nile virus. And the last hazard was food and waterborne illnesses, which is higher temperatures promote bacterial growth in food and water sources, leading to an increased risk of other diseases caused by pathogens like E. coli and Salmonella. Warmer water temperatures can also lead to algae blooms, which releases toxins which is harmful to humans and aquatic ecosystems. So by identifying these hazards, our goal is to support municipalities and public health agencies in developing targeted mitigation and adaptation strategies to protect the community health. So why is this relevant to municipalities? Climate-related damages already cost Canada billions in dollars, and in disaster response and infrastructure repairs, so municipalities must act now to limit the long-term risk and protect public health. So what can municipalities do? Municipalities can strengthen their emergency preparedness, implement climate resilient infrastructure, educate communities on climate risk, and integrate climate considerations into municipal planning. Mitigation. So mitigation efforts focus on reducing greenhouse gas emissions to slow down climate change. How municipalities can mitigate climate change. Some examples include expanding bike lanes and sidewalks, increasing tree planting and green spaces, as well as focusing on more energy efficiency, supporting waste reduction and composting, and promoting renewable energy adoption. So for adaptation, adaptation means adjusting to current and future climate impacts by making communities more resilient. So how municipalities can adapt to climate change, again, examples include building climate resilient infrastructure, establishing community cooling centers for heat waves, and enhancing disaster response planning, as well as expanding public education on climate risk. So can you do both? Short answer is yes. Long answer is also yes. Low carbon resilience approach integrates mitigation and adaptation for a sustainable climate smart future. So climate change data. Reliable climate data is essential for planning. Our health unit provides online climate dashboards, local data for municipal planning, and also reports from the Rural Ontario Institute. See where the action is. So in terms of us starting an action, really join climate action groups, collaborate, and share resources to strengthen community resilience. So know the risk and be prepared. Our region faces severe storms, flooding, drought, power outages, and wildfire due to climate change. To support preparedness, we provide resources on our emergency preparedness and climate change sections of our website, which is including a climate change fact sheet. So key planning strategies include integrating climate resilience into our official plan and developmental bylaws, implementing adaptive strategies to address evolving risk, promoting sustainability to reduce long-term vulnerabilities, and demonstrating leadership through comprehensive climate planning. In terms of communication and resources for municipal partners, the health unit provides educational materials, social media toolkits, and also support for municipal climate plans. Right here. So these are some of the resources and fact sheets. And that concludes the presentation.
Thank you, Zara, very much. Great presentation. I can't believe, though, that you keep saying CCHVAA.
Yeah.
And you haven't. I kept trying to do it, Chava. What do you call it back at the office?
We used to say it's CCHVA, but then it's just like, they're like, no, say CCHVAA. So I was like, okay.
Oh, okay. I just want to say Chava. Thank you so much. Comments or questions? I have a couple, but...
Go ahead, I guess.
All right. When I think the kind of impacts that you're referring to, they were... I couldn't find a better word, but they're the primary impacts. And there's another level above them, like secondary impacts. So you've talked about, diseases and flooding, but then if we get into disasters, they lead to rising costs, and then rising costs make living, or particularly for vulnerable people.
Yeah.
And then the secondary, you get into climate refugees almost, and then that impact the instability that leads in the world, and then that leads to like you just keep going, right?
Yeah, it's never ending.
It's never ending.
Yeah.
So your focus really was the local, what can we do
Yes.
at this level, and these are the immediate impacts on our neighbors, friends, and family.
Yeah, so we were a big part of at least our report was, and this was one of the factors I discussed, was looking at other CCHVAs from other municipalities. And then that kind of helped us to align our report. So that's why a big chunk of our report does focus on those 6 health hazards I discussed, including, let me go back to my notes. Yeah, extreme temperature, extreme weather events, air pollution, UV radiation, vector-borne diseases, food and waterborne illnesses. Obviously, there's a lot more, but this kind of encompasses a majority of them. That's why we chose these topics. But the main essence of our report is focusing on really climate change, what can public health do, and then how can this help municipalities to better align with future official plans or development bylaws. So that's what our main target is currently.
And was this tool, first, where did it come from? And 2, was it developed specifically for public health and municipalities to do these kind of assessments? Do you know?
In terms, can you rephrase for
You
the
know
tool?
where it came, who developed the tool?
I'm not too sure on
Okay.
that. I can get back
But
to
it's a
you.
widely
Yes, yeah, it's
adopted-
like other municipalities, public health units use this,
Okay.
and that's kind of where like, okay, we should be doing one too for our region.
Okay.
So I think that's where the main focus was for
Great.
that. Yeah.
Joanne.
I just have a question. When the report's finally official and out, Zara's happy to come back and share that with us. What's my question now? Oh, yes, the data. How is it displayed? Is it going to be across the Southeast Health Unit now, or will there be chunks of the legacy health units? Like this was LGL, this was KFLNA, and this was HPE, or is it going to be one big, like all of Southeast, or do you know?
Yeah. Originally, because I was in part of the working group. So when we were working on the data before we merged, it was section by section, focusing from LGL's perspective, KFLNA's perspective, and HPE's perspective. I think now that we have merged, we might align it a little bit better, but it's very easy to see and distinguish in the report, like where LGL's focus is. But when it comes to our recommendations, it will be cohesive from a public health point of view. Like we should be targeting this. Yeah.
Perfect.
That helps.
And then, go ahead, Sean.
Oh, no, go ahead.
No,
You're at it.
Okay. My other question, or maybe it's more of a comment, I just keep thinking about communications around climate change and what really resonates with people and what messaging makes people want to take action. I don't think your report dived into that literature, did it?
Yeah, no, we didn't
did.
focus
Okay.
on the social media piece, but we focused more on that high level of what municipalities and public health can do. And one of them being the big piece was the official plans and the development bylaws, and at least from the municipality side, but then also education and awareness from the public health side when it even comes to like employees and understanding what climate change is really.
I can see where the health unit might take a role in supporting municipalities around the communication pieces pertaining to the health aspects, if that's what speaks to. I guess everybody has a different way of responding to climate change, but I think that we could probably do some research and lit reviews around that piece on what is the best way to get this message across so that
100%.
Yeah.
I think so. Yeah.
Awesome. Thank you.
I'm going to go to Sue and then over to Sean. Sue, jump in.
Thanks, Peter. Yeah, I've just got a few questions and comments here. So one, and I apologize for the simplicity about this one, I just need to understand, the city of Kingston is part of the Grand Southeast region now, am I right?
Yes, the public health. Yes.
Okay, that's good to know. Okay, so I'm just using this as an example, but it's my understanding that Ontario does not collect deaths by heat in terms of data. Quebec does, BC does.
Okay.
Is that correct?
I can get back to you on that. We had a separate person for data that was looking at it, so I'm not honestly too sure about how the data were collected or if
I'm fairly sure about that. I think it's an enormous gap. And I would like to see in our work in the Smith Falls Committee a recommendation go forward that says that Ontario should be collecting that data. And if at all possible, then for us to put pressure on our local hospital. I would like to know from Smith Falls Hospital how many accidents or deaths they have as a consequence of heat, in the winter of a consequence of ice storms, of, slipping and falling on ice. We hear anecdotally that that's the case, right? Whenever it's icy, we hear reports of friends, neighbors, whatever, having horrible times, breaking a leg, but we don't have that actual data. And to get to the other point about communication, I think that's critical information to have, to be able to communicate, to say, we're seeing an increase in the number of broken hips as a consequence of local climate change. Is that something that the health unit can be assisting with?
We can chat with John, who's our
Yeah.
epidemiologist, and
Yeah.
he'll be able to let us know exactly
we
what's
can
being
definitely
collected.
discuss with the EPI. I think EPI will know the answer for sure and how to collect that data as well.
Well, I'm going to suggest too, Nelson Rogers, who is local and has been a key force behind the Ontario Rural Institute's data, their whole program, is looking to do workshops in the next very short while in terms of data collection and what we as climate activists would like to see locally. So if the health unit could be working on this a little bit more quickly, then we might be able to feed that to Nelson and actually get some action taken on specific data that we can be collecting in the next, changes in data collection so that we can be getting this sooner than later. Does that sound interesting?
Yeah, I'll jump in, Sue.
Yep.
Great points. I happen to been hanging around the health unit board for 6 years. There's only about now less than 30 health units in Ontario, and they meet regularly. And there is if I'm not mistaken, it's either the medical officer of health, but there is I think a climate action work group so we have a provincial association and various committees. And I would be surprised if they don't have a data set, and that they aren't already lobbying the province to collect the kind of data that you're talking about. But we, as Joanne has said, we will get back to the committee on that.
Great. Because if the health unit is working with the Ontario Rural Institute on data collection, that seems to be a natural partnership then, right?
Yeah, they have a formal relationship with the university and the institute.
Right.
Okay.
Okay, great.
Stay tuned. Zara took
thank you.
Is that all then, Sue? I'll throw it over to Sean.
Yep, nope, I'm good. Thanks.
Okay, thanks, Aaron. Very insightful and very encouraging to know that the health unit has a strong focus on climate change and impacts on health. Has the study focused on prioritizing the potential risks? What has the greatest probability and also the hardest impact, as an example? So I'm thinking some of these things are low probability, like a tornado, and obviously have a huge impact if it happens. We know the probability isn't that high. But I would also think that extreme heat, and to Sue's point, has very high probability and also a very high potential impact on health or even on death. So has that been sort of scored, or is there a focus on that to know, especially as a partner municipally, what maybe we can do to try to help combat that? I'd say extreme heat, extreme temperatures, high heat to very cold temperatures, especially for those who are unsheltered in the wintertime.
Yep.
Yeah. So when it comes to, at least from when I was working on the report, a big factor for the health hazards was focusing on really, what the health hazard is and kind of tailoring it to the Southeast region itself. To your specific question, I would have to get back to you because that sounds like I don't think we kept a scorecard in terms of this is definitely going to be happening like in the next 10 years, but more of a broad scope in terms of when the data was being collected, looking at it from at least our region's point of view and seeing these are the different factors that are coming into play. How can we focus and kind of mitigate that? So that will be, I think, discussed in the report, but I can definitely get back to you and give you more detailed response once finalizing it.
Okay. And the second question, I guess, is there a demographic lens that's applied to this as well? And recognizing that those of us who have central air conditioning and tend to move from one air conditioned environment to another during the extreme heat aren't as impacted as much as those that may not have access to an air conditioner. And especially I think people who live in second or third floor apartments in urban areas where they don't get any relief from the heat in these situations. So And again, and those who don't have transportation, maybe recognize in extreme cold, the same thing applies. If you have to walk a kilometer or two to get your groceries, you're more probably at risk of getting frostbite in minus 35 conditions than those of us who can hop in our car and go where we need to go.
Yeah, in terms of that, I think a lot of the data is done by the public health unit, like the EPI, from now KFL-NA, like a Southeast Health Unit overall, as dashboards. So I think that data may be available, and I can definitely find the resources and connect with you and send them to you afterwards. But for the CCHVA report, it was just focusing on a bigger level in terms of just really discussing what climate change is, what the health hazards are, and then also providing with the staff survey report, the key informant interviews, and then other sources out, like comparing with other CCHVAs, providing the recommendations. So as it becomes finalized, and hopefully it'll be released soon, then you can see the breakdown in terms of a bigger level, but to focus on specific populations itself and to see what the main issues are. I think that's more towards looking at the data itself and the dashboards that should be, I think, available to focus on.
Okay, so I think maybe from this committee, once we have that information and understanding, maybe we could take some time to understand the impacts on our own community, especially when we apply the demographics of our community, and see what steps maybe we can make to try and help mitigate the risks that, especially those of the most highest probability of happening, and heat waves certainly are the one that comes to mind.
100%.
Okay, thank you.
Joanne?
Just going back to your first question, Sean, around whether or not we have a matrix that prioritizes like risk versus, I can't remember what the other thing you said, but I know, just Zara, for your information too, the health unit does do a hazard assessment every year. It's not necessarily specific to climate, but we do look at the environmental hazards in our area. So do we live along a highway, corridor such as the 401, where we're at higher risk of, say, train, accidents, incidents, or spills because of large cargo that's being carried, or are we living near areas that have an increase in flooding? So I know that we do that yearly. I'm not sure where that sits. So I can get that information as well, because that we do go through and score what those environmental hazards are. So I'll figure out where that sits and who that belongs to at this point. It's been a while, so.
I would be tempted to bring the Chava to the Smith Falls Emergency Planning team for their next exercise, almost like a prerequisite. View this and then bring it down, using that as your risks that have been identified and vetted already for us. And that we already know our local data. And the fact we have so many people in apartments in our community, but we don't know how many don't have air. But there's so many above our stores. And anyways, I think it would be a prerequisite before we did our emergency planning for the committee that does that to understand that.
Yeah, 100%. I think, especially with like the CCHVA report, when it comes to climate change, the team can definitely utilize that report because the research has already been done, it's been validated. You can pinpoint key areas that tailor to Smith Falls, and then create this emergency preparedness more focused because the research is there, not to present it.
Very interesting, and it sounds like you've got some work to do to bring some information back through Richard or Marie or myself, and we look forward. So we'll put it on our next agenda. Just maybe a month. Does that give you enough time to get that?
I believe so.
And we'll bring it back. And at some point it'll be public, and maybe we could bring a shorter version to municipal council or something when it's out there.
I know we talked about bringing it to the municipal public health calls as well, but I don't think those are happening anymore, unfortunately, with the merger. There might be something in place of that, but we can bring it here specifically.
I was just going to ask that. Is this going to be taken to other lower tiers in Lanark County and or the county's climate committee?
Yes, so other team members will be presenting this to other municipalities and counties that are within our area and region.
So you're welcome to stay for the rest of our meeting, or you can go over to Tim Hortons and put your feet up and relax after that stressful busy.
Yeah, super stressful. Yeah, I have another meeting, but yeah, I would love to stay, but maybe next time.
Very nice to meet
Thank
you.
you so much. Nice
And
meeting
thank
everyone.
you so much.
Thank you. Thanks, Sarah. I like the Shiva. I'm now going to
Well,
refer to it as the
I just couldn't
Shiva.
stand saying all those letters. Nothing else on that item. So we're down to the election of committee chair. I did, as your vice chair, I stepped in when Joanne, wonderful news, she's moving on to a different portfolio within the organization. And will still remain with us for a while, but had to step aside as chair, and I was happy to fill in. And at this point, if there is anyone who would like to be chair, now's the time to put your hand up and you don't need to be nominated, you can nominate yourself. We're a little bit informal here. Yeah, I'm not saying that.
If I may speak, Mr. Chair, if I can make a nomination, if you would be willing to continue on in this role, I would deeply appreciate that.
Sure, I'd be glad to. No, I don't mind, I really don't.
Yeah, you could do a wonderful job.
So it's been moved by Sean. Seconded.
I'll second it.
by Sue. Peter McKenna be nominated as chair. And seeing any other nominations? Seeing none, all in favor? That's carried, thank you. Richard, project updates, milestone 2.
Yes. Okay. So the survey has been completed and we had 92 responses, which surprised me actually. And it was open for 3 months, by the way. So we're just going to go through the responses for each question, just because I think it's easier that way. In the report, I have provided a sort of summarize the highlights, but this, because it's digital, we can see it on the screen, it's easier to go line by line.
I'm sorry, I'm going to jump in, Richard. Why did it surprise you? It was high or low?
Well, because the last time I did a survey, it was for the official plan, and we only had 34 responses. So this sort of surprised me because we had a lot more responses, and they came at later point in the time. So for some time, it was still hovering at 32. Then suddenly we got a flood of responses. So I was pleasantly surprised.
Good.
But you've got to admit, official planning.
I was so engaged.
Really important document, but redrawing,
Probably subject matter played into it.
yes. All right, back to you, Richard.
All right. So the first question was, how many people are in your household? And you may not be able to read that, but 59% of people had roughly 2 people in their household. And at 3 to 4 people, we had 28%. So the most of the respondents had roughly 2 people in their household. And the other question was, how old are you? And most of the the biggest cohort was from 65 to 80. So 44% of the respondents were in the 65 to 80 age cohorts. And the second largest one was from 41 to 65 at 44%. Unfortunately, we weren't able to get a lot of the youth responding to the survey, or at least not indicating their age. So that's just so for what we have from our respondents. And most of the respondents lived in Smith Falls at 68%, and 32% did not live in the area. And in terms of transportation, not surprisingly, 87% of the respondents drove, while 11% walked, and then 11% and the other for the other 1%, and 1 for carpooling. So looking at question 5, it's not as organized as neatly as I would have liked it, but essentially, financing was seen as one of the biggest barriers to taking climate action, as well as an identified other. So applicants responding to the survey were indicating that besides financial barriers, there were other things that preclude them from taking as much climate action as they would like. One of the big ones besides finance was not knowing what to do with the property and where to get information. So I think in terms of order, we would say that most people financially weren't able to engage with climate action the way that they wanted to. And then the other thing, as we were not surprised about, was that most of them did not know what to do with their property or where to get information, if they had the wherewithal at all. So that's something that indicates that we could probably do more in terms of communication and trying to find ways to educate the populace, as well as finding solutions that may not be so cost prohibitive.
Oh, no, I didn't hear that.
Moving on to question number 6, how often do you buy food from a local farm producer or farmer's gate? And 32% said that they did that on a monthly basis. And the next highest respondents were those who did it at least twice a year. So that indicates that people are doing it fairly regularly from at least a monthly basis to twice a year. Moving to question 7, looking at how important do you think it is for the local municipality to take action on GHG emissions. 75% of respondents said it was very important, which does not surprise us if they're taking the climate action survey. They would definitely agree. Moving to question 8, how likely are you to take advantage of a community garden? And 46% of respondents said not likely, with 31% saying likely. So it's almost split between those who would find it interesting and helpful versus those who may not find it useful at all. Looking at question 9, home energy retrofitting. Most said at 40%, most said that they were very likely to take advantage of that program, and 24% very likely. So I think most of the respondents at least indicated some interest in taking part of a home retrofitting program. And then looking at question 10, 68% are very likely to compost their food waste, which kind of gives us a bit of hope for looking at having a green bin program. Now, looking at, we'll come back to that. So looking at question 12, we would say that in terms of the town's urban canopy, 82% of the respondents would plant more trees on their property if they were able to. And then here we're looking at the list of questions people would be asking in terms of climate initiatives. Now, in terms of the survey, despite the fact that we had 92 responses, half of those responses were providing supportive solutions or ideas for climate action. And so what I did was I didn't itemize it here, but I kind of documented all the possible solutions that people were proposing. And I also added numbers for those that were repeated more than once, just trying to indicate things that seemed to be more of a common idea. For example, a lot of respondents said that they would like to see solar panels on residential homes. Some folks wanted to see the electric generators at the falls. That comes up quite a bit. Some definitely would like to see an electrified fleet. And others would like to see things such as a tree cutting bylaw for private property, and some would like to see affordable, accessible public transit. So these are some of the ideas that the community were suggesting would be important in terms of a climate action perspective.
And none of these were prompted. These are all just.
Yeah, they gave them these. They submitted them themselves.
Right.
Yeah, so this is something that they were giving. If you want to know like all the responses, I can provide that after the fact, but this is just sort of a summary of the responses that I received. One question that is not on the slide deck was a question about how likely would you be looking to reduce your emissions? That was a question on the survey. And most would think that walking would be the most effective option, and also using an EV vehicle. Others said that carpooling and using a scooter would be helpful, but that was very low at 4%. The most would be walking would be 24% of respondents, and 13% of respondents suggested using an electric vehicle for getting around. And that was just question 11 that's not on the slideshow right now. Moving to question 14. "82% of the respondents heard about the group, and 18%. Wait 1 second.
I didn't understand that one.
No, I feel like that isn't.
Missing some information.
Yeah, no. Okay, so here's the correct information. So 53% of survey respondents heard about the CPWG group for the first time through the survey, with 23% hearing about it by word of mouth and 24% hearing it from the newspaper. So that'd be the Record Journal. And the last question, well, we can't read it here. 55% of respondents indicated interest in receiving further updates about the Climate Action Plan. So those are from the survey respondents. So roughly half the folks who respond to the survey want to hear more about what's happening with the group and also the Climate Action Plan.
And would they have left their contact information? They did. Okay, good.
That's very
Yeah,
good.
I'm surprised. So.
Okay, comments or questions on the survey? The survey says. Is there anything that surprised you, Richard?
Yeah, there are, but I'll let Sue speak first and then I can get into what I found was interesting.
Go ahead, Sue.
Ooh, hope that's not a real problem.
She's on mute.
I can't hear you, Sue.
Okay, there we go. Now I'm on. I apologize. So unlike Richard, I'm not really surprised. But I think the responses are great. I think this is a really good stepping stone forward. And the 50 basically that we have now as ambassadors is fabulous, just fabulous. So we can really do something with that. Good work.
Yeah.
Anyone else? Again, this when we get to council, I think as we present our report, knowing what the community support, at least we have from the people who responded will be, I know council members would appreciate hearing their particular views, the public views as well.
Mm-hmm.
Yep.
Okay, so you wanted to know my thoughts?
Yes, I do.
Okay, so I was pleasantly surprised. So a lot of the solutions, so sometimes you can think of things like having a direct impact on reducing GHG emissions. Like if you retrofit your home, you can see the actual reductions over time. But then planting a community garden, those don't seem to have a tangible direct impact. Where if you plant a garden, how are you trying to calculate emissions? It's different. It's helpful, yes, because it kind of allows us to think more locally. So there are other benefits apart from just direct emissions. And what I found interesting is that looking at the responses, a lot of them are seeing that it's not really so much about what you can buy to reduce your emissions, but it was more about education, awareness, and just having enough information to make different decisions. So they wanted to have a tree planting program, but also educate homeowners about what the appropriate size of trees would be available. And also telling the town that if you're providing trees, that they should be at least appropriately sized for your property. So like every time we're either promoting an initiative, there's an education piece that I think is helpful. And seeing a lot of the comments, it kind of reminds me that that's probably what we need to do as well. Apart from, buying solar panels or electrifying the fleet, but also just including the community as much as possible in those endeavors.
Mm-hmm.
Yep.
Yeah, so that's all I have really.
That's great. So we'll receive this as information and it'll help inform our
Yes,
final report.
that's right. So what's going to happen now is that the answers from question 13 will be folded into a list of sustainability goals that I'm putting forward. And so that would be the sort of initiatives that the community supports, as well as something that kind of works with what I guess management would consider. So when it comes time to the target setting and the climate action planning, we'll have a little bit of background information that kind of feeds into the development of the climate action plan.
it's a interesting time. Yeah, Sue, go ahead. I was going to make a comment.
Yeah, I think it's so critical that we build on those 50 ambassadors.
Yeah.
And so what I'd like to see actually is a small report on the results from the survey. You know, why hold them just for us? Let's compile them into a small report.
Okay.
Let's send that report out to those 50 because they've given us their contact information, right? They want to know more. Let's actually put it out into the media too, right? Because
Great idea.
it's a positive report, and we don't have to cover everything in it. You know, it could be short, but we just say we've done this survey. Here are the the global responses, and here are some of the great ideas that the community has come up with. That sort of thing, right?
Yeah, that's a good idea.
Yeah, we heard you. Here's what we heard from you. Yeah,
Yeah, what we heard report. Okay.
that's a great idea. And in that would be, here's what our next steps are.
Yes.
Stay involved or whatever.
Stay tuned. Yeah. A little newsletter kind of thing.
Can you manage that with your communication team?
Communication team, yes.
We've got communication people.
No, we do. Drafting the report shouldn't be too difficult, and I can work with our team to get the word out.
Right.
Yeah.
Great idea.
Make it short, sweet. You know, it doesn't have to be lengthy. It's just enough for those people to feel connected to us now, right?
Okay.
And a thank you to them, and here's what you've told us.
Okay, I like that.
The context, which when we did the survey, has shifted dramatically with the threat of tariffs, the hyper-local, hyper-local focus, or shopping locally, buying locally. I mean, it would have probably changed some of the answers to many of the questions. Okay, and so the direction, you've got that, Marie, that the committee wants to...
Have a what we heard report?
Sure.
Yep.
Before I go to the round table, did you have anything else?
No, I think this is all that I had, actually. Just the survey results.
That's lots.
Yes.
That's good. I neglected to appoint a vice chair for when I'm away, and I meant to do that.
Okay.
And I just, as your chair, I'd like to come back to you one more time. See if someone, as you know, I'll stick it through to the end. But if, God willing, but if anybody, it's nice to have a backup if I can't make a meeting. And so if anybody would like to just raise their hand to be a backup to the chair and act as vice chair, I'd appreciate it.
I don't mind stepping in if you're not able to be here.
So the mayor's put his name forward if I'm not around.
Fabulous.
And Sue has moved that.
Yep.
And is there a seconder? Linda, you want to second that for?
Oh, yes, I'm
Yes.
sorry.
All in favor? That's carried. Thank you. That brings us to the round table. Anyone have anything they want to talk about or need to talk about? Linda?
Yes. Now, I'm not sure whether it's not too early for it, but as Sue has said, we need to promote more. With Old Home Week coming, if things could be ready for a table manded up here at the town hall with all of us, and have all the information on pamphlets, and even to give out little wee tiny trees in a cup that you can plant at your house, and ask maybe a questionnaire there. Maybe somebody will give more questions that they have. So I say it's a bit early. It's not till August, but things need to start rolling, I suppose. And that's my input. And actually, I'm with Sue. This was great. I've never seen so many people actually do online. Usually you don't get any feedback. This was a wonderful thing. I was really enjoyed it. Yeah.
So Linda, I'm glad you brought up the Old Home Week Committee. They do have an environmental lens that they're running the whole, and if you're not familiar, Old Home Week, it's a week-long event that happens every 25 years. We have a giant party in Smith Falls, August 2nd to the 9th. And the committee is committed to reducing waste and having the minimal impact on the environment as they can. And there is one day, there's a focus on health. So that might be a good day rather than the whole week. If we had, I wonder about being part of that and linking it to the Chava somehow. Just pointing out the impact on the environment and the work of the committee. Now, by August, we will have already produced our.
We'll be working on the first draft and something finalized by September.
Okay.
Yeah.
Well, we could probably put out some teasers.
Oh, yeah.
What's in it? Okay.
We could probably put up some teasers leading up to it, as well as have something for the month of August if there's something on the table. We have to plan for it, though.
So it's a good idea, Linda, and I know you've said you would be willing to.
Oh, yeah, I have no problem being on beer all day. That doesn't bother me. Now, when we were kids, another subject about trees, I was telling Marie in grades 6 or 7, well, that's going back a lot of times, we used to have a day that we used to go out with a partner in somebody's field or like Campbell's farm or whatever. And we'd have a partner and we'd plant trees. All these trees are in a bucket, and each partner would get it. So I wonder if the education would be interested in letting the schools do a day for trees.
I do know that the Rideau Environmental Action Group, REAL, have worked with the schools, have planted trees in the last few years.
Okay.
But to let them know that we hope or somehow get, because they've already got the relationship with the school boards.
Yes.
So I think they would be happy to keep doing that. And I know they're planning a second mini forest as well.
I was gonna say,
Yeah.
But they're all good ideas. And to find a group that already is committed to doing it.
Now, if you were at Old Home Week and with the table there, would it be if we were going to go ahead with different kinds of boxes? Not that we have a blue box and a yellow box, let's per se, we're going to have a black box. Then would we have them ready available for anybody that would like to take another box?
for what, recycling?
Yeah. So what would we do at that table? I think we could look to, we could probably get together outside of this, come back with some ideas for the next meeting about what that table would look like. And that would be one idea of recycling, or those little compost or
Oh, the green bins?
Yeah.
tabletop.
Yeah.
Yeah.
You might entice people to take them, but it's harder in an apartment. Like, where do you put it? You know what I mean? But
Yeah, I have
people's with housing, like, you know.
And I know the concierge group that Sue is part of, that, I mean, there's a number of ways we could,
do this event.
you know, so do something around climate during the Old Home event.
Yeah.
And I suggest, I don't know why I say health, and because it is really about climate change. Is a lot about health.
Well, it brings a lot of people out from around the area into Old Home Week. It
Yeah.
always has, you know. So it might even help somebody in another district that they have the idea of it too, right? You know, education.
So would somebody like to work with Linda to come up with a couple of ideas to bring back for the next committee meeting?
So when, yeah, we can brainstorm something. So we have to see what capacity we have and have a real conversation about that.
And Sue,
Can I just ask first, I think you mentioned it to me last summer, Peter, the possibility that Old Home Week might be asking CNL to do the same thing as we do at Stewart Park with the green waste depot. And I haven't heard from anybody at Old Home Week, and it would be good to know if we are going to be asked or not. It's a huge thing to organize, and we're now, just starting to get our summer planned. But just so you know, for the Stewart Park Festival, we use 40 volunteers over 3 days. And so if we're looking at doing the same thing at Old Home Week, then we absolutely would be looking to this committee to be helping us with that, right? But just so we just need to have some communication between Old Home Week and us sooner than later.
Okay. I'm meeting with the Old Home Week chair on Thursday. And I know they've also reached out to Real for ideas on how they could be a greener event.
Right.
But I think, and would you be the contact person, Sue?
Yep, I'll be the initial one for sure.
Okay. And I'm on that committee, so I will.
Great.
We've already lined up about 75 volunteers for the festival without asking.
Yep.
There are people that want to organize and there are people that want to do.
Yep.
And some people are
That's
willing
great.
to do.
So I'm going to say, yep. So the 40 volunteers that we use at the Stewart Park Festival are in addition to the 100 that the Stewart Park Festival uses.
Right.
So we're just talking about 40 for the Green Waste Depot.
Okay. It's also, they were interested just in advice on how to run a more climate friendly event.
Yep.
Not just actually doing it. So I'll put them in touch. And Joanne's got her hand up.
Just a point of clarification. So was this committee thinking about doing something for the health fair day during old
That was my suggestion.
Yeah, okay.
Appropriate.
Okay.
Yeah.
Because I think about 6 months ago, the chair contacted me about whether the health unit could get involved, and I said absolutely, but it was sort of broad at that time.
Yeah.
So the health unit might be there as the health unit, but certainly we have a display on climate change that I could bring to support this this committee, which speaks to the health risks of it. So if it's just one day, I don't think we can commit to a whole.
And it's a certain number of hours.
Okay.
Yeah.
Okay.
Yeah, Mayor Pankin.
And then to Linda's suggestion, maybe the tree giveaway, maybe Richard could reach out to the RBCA.
That, and also speak with community services to see if they have any themselves.
Yeah, like, and if it's seedlings that we want to hand out as part of our effort.
Usually Gemmels or one of
Is
them.
August
too,
the time that you do that?
Gemmels.
Oh, true, right.
That's all.
I don't know,
Yeah, I mean,
but maybe flowers. I don't know. Like it could be anything, or giveaway seeds or something. I don't
package,
know.
yeah.
Yeah, it's,
Or a free
It's not-
giveaway. Here's your coupon for tree.
True.
Yeah.
Anyways, Linda has got some ideas and Richard will, and Sue's already suggested a couple things, Joanne.
Okay,
So
well, Richard, I'll meet with you up here at your convenience.
okay. We'll set a time.
So we have a table and it sounds like a tent and we can piggyback on public health's table for that particular event. Separately is how to run a more climate friendly event. And Sue and I will be in touch with Shelley and Krista on that this week. So, well, not when you're back, I mean, Sue.
Yeah, that's okay. I would just add that if you are looking for trees, for seedlings, now is the time to be talking with Ferguson Forestry Center.
Yeah,
I
I agree with that, yeah.
Because you can't let that one drift.
All right.
They run out of trees pretty fast.
It'll be an old Home Week tree that in 25 years will be a forest.
Oh my goodness.
Yep.
Intriguing.
Any other roundtable items? Sue,
Sorry, yes. So I know I sound like a broken record on this, but I'm hoping, Richard, that you have been invited by the county to attend their regular meetings.
I received formal invitation. I'm trying to look at you, but no, I've not received any communication from the county to join the meeting. I'm not saying I shouldn't come, but they haven't invited me
Probably
personally.
open.
Like I'm
Okay.
pretty sure it's
So-
fairly open.
Well, no, I mean, so it is and it isn't, but I've actually formally talked with the clerk there, with Jasmine, and she has responded with a couple of very positive things. And I know she has now sent emails out to some of the previously named lower tier municipal reps, just to re-invite them or ensure. So can I encourage you to just reach out to Jasmine and say you want to? Like, I'm sorry, I'm getting fed up with this bureaucratic muck. And it just should happen, right?
Okay.
So that would be really good. The next item is just to say that so as Climate Network Lanark, we are in effect soft launching our next wave of our concierge program, and we have clusters forming in Perth and Almont. And so as those go, and as more happens, we'll be forming one in Smiths Falls, and we have phenomenal support funding from the Gilligan Foundation, which absolutely loves our program. Great partnership with the county and the program that they're bringing on. So just to let people know, we will be doing more marketing, like actual, more blatant marketing. It's been soft so far, but we've had people signing up anyway, which is just great. So that's that. But the other thing that I really wanted to mention here and just have acknowledged is the horrible impact of what's happened south of the border on the climate issue. And I want that acknowledged because we're really up against it. And what is going on there, and I don't just mean the withdrawal of the United States from the Paris Agreement, but the whole attitude, right, of pushing down electrification, of increasing fossil fuels, of an attitude that says that climate change is a hoax and whatever, right? I'm sorry, I'm gobsmacked because I think we need to acknowledge that this is in fact the worst thing to happen on the climate front, and that we have to be cognizant of that, and we have to be integrating it in all of our thoughts, all of our plans for actions going forward. That's enough from me at this moment. Not very articulate, but I think you get my message.
Yeah, sadly, we do hear you, Sue. Anything else on the round table? Seeing nothing, our next meeting is March 11th. Please let Marie or Richard know if you'd like to join virtually or unable to attend when you're aware of that. And so we'll take a motion to adjourn. Moved by Linda, seconded by Joanne. We've adjourned the meeting. All in favor? It's carried. Thank you.
You